REM sleep behavior disorder is a sleep disorder. It belongs to a group of sleep disorders called parasomnias. In these conditions, patients who are affected by this disorder act out their dreams. And these dreams are usually filled with a negative emotional context. Patients are frequently threatened in their dreams, and they are able to act out their dreams and try to defend themselves from their sleep, as they are not paralyzed like we would normally be if there was no RBD present. This condition has been really in the focus of a medical and scientific community over the past 10 to 15 years, and increasingly so over the past few years, as it is clear that in majority of patients affected with this disease, there is likely an ongoing neurodegenerative process that leads to one of these conditions that we call synucleinopathies. And there are three major diseases. There are three major diseases within this group: Parkinson's disease, Lewy body dementia, and multiple systems atrophy. So our patients who act out their dreams in the middle of the night, especially those who are above age 50, are at really highly increased risk to develop one of these conditions. And that's why this disease has become very important, because it enables us to have a window into the early stages of this neurodegenerative process that at the moment we don't have a cure for. In the core of REM sleep behavior disorder is the disturbance of the circuitry within the area of brain called brainstem, and these connections within several brainstem nuclei and their connection to our peripheral skeletal musculatures are something that are disturbed in this condition, and that are actually enable individuals with this disorder to act out their dreams. We now understand that as pathological process of these synuclein-specific neurodegenerative disorders progresses, as it marches through the areas of brain, it certainly affects brainstem regions as well. And those pathological changes are then becoming responsible for dysregulation of this circuitry that is responsible for normal REM sleep. And as these pathological changes are occurring in the brain, one of the manifestations, as I mentioned, usually in the very early stages of neurodegeneration, is the emergence of this REM sleep behavior disorder.